chat about anxiety. Now, first, understand I'm not talking about generalized anxiety disorder specifically, just about the symptom, the feeling of anxiety, which anyone and everyone could experience. Now, I'm sure you've experienced this as a student or in your personal life. So what might it look like, and how do we care for a client who is experiencing anxiety? Now, by definition, anxiety is a sense of worry or nervousness, typically about some sort of upcoming event that may or may not have an uncertain outcome. So this is relatively a normal part of life, right? Things come up, life happens, we have this sense of worry. So there is that normal type of anxiety. It's actually pretty healthy, and it can even be motivating or can produce growth and kind of move you forward. So there is such a thing as a healthy level of anxiety, and that's okay. Now, acute anxiety is sudden, and it's usually related to some sort of event or a threat, maybe a near-miss car accident, or you find out that a loved one is sick or in the hospital. That acute, sudden anxiety related to something that happens. This is also relatively normal. The problem comes when this anxiety starts to overtake your life and keep you from functioning or becomes persistent and chronic. This can mean you're anxious about normal activities, normal everyday things like driving or going to the grocery store make you extremely worried or nervous. And that's actually when we as healthcare providers also start to be concerned for you. So in addition to the types of anxiety, normal, acute, and chronic, there's also levels. So at the very bottom, this is someone who is anxiety-free. They're doing fine. Nothing is worrying them. And then you have this mild level of anxiety. That's kind of like the normal, motivating, growth-producing anxiety. Again, this can be normal, but we don't ever want anyone to stay there. Now think about how you might feel like right before a test. You've got this level of anxiety. You studied really hard. You're nervous. It actually keeps you focused, kind of makes you do a little better. Imagine now having that level of anxiety all the time. Like, how awful would that be? So while this level's okay and it can be healthy, we really want people to come back down into this anxiety-free level as often as possible. Then there's the moderate level of anxiety. You can still function, you can still problem solve, but it's very palpable. It's a palpable nervousness. It might even begin to affect you physically or affect your ability to focus. You might even start to see their heart rate or their respiratory rate go up when they're in this level of moderate. Now, the next level is severe. At this point, you really can't get yourself out of this level. You're kind of stuck in this severe level. You need medication or maybe just outside intervention to help you come off of that overwhelming sense of worry. You're just so focused on whatever it is that kind of got you there that you can't get out by yourself. And then there's the panic level. This is the ultimate level. It comes with this sense of dread, sense of impending doom. You're definitely going to see physical symptoms here. You're going to see an elevated heart rate. You're going to see an elevated respiratory rate, probably an elevated blood pressure as well. And no matter what people say, no matter what people do, no matter how much you try to reason with yourself, you absolutely cannot calm down. It usually requires a significant intervention or medication, and a lot of times they start to lose rational thought. Everything is terrifying when you're in this level. Now, for those of you who've never experienced a panic attack, I'm so glad for you. Please be empathetic and understand that it is absolutely terrifying. I've actually had 2 panic attacks in my life, and it's so scary and hard to come down from, and you kind of literally feel like you're losing your mind. So just know that this is this loss of rational thought, sense of dread, impending doom, and it absolutely requires intervention. So one thing I want you to realize is that the frequency with which someone experiences that panic level anxiety is going to be entirely dependent on what level they exist on. If someone hangs out right around here in this anxiety-free, maybe a little bit of mild, but back down to anxiety-free, that jump all the way up to panic is very significant and doesn't happen as often. I'll tell you, I live around here. This mild anxiety, every now and then I'm anxiety free, but usually I'm living around mild. but I don't get panic attacks very often. But imagine someone who lives in this moderate to severe range. This jump up to panic is much shorter and can happen much more frequently. And so people with these higher levels of anxiety are more prone to panic attacks because their threshold is higher. So make sure that you recognize somebody's baseline level of anxiety, because that's going to help you to recognize some of those significant changes before they even get up to the panic level so you can intervene. Now, really quickly, I just want to review presentation and management of an acute anxiety attack or panic attack. So like I mentioned, you'll probably see physical symptoms like tachypnea, tachycardia, diaphoresis, maybe even an elevated blood pressure. They have this sense of impending doom. They may even tell you, I'm having a panic attack, especially for those of us who have experienced them before. And you always, during these moments, you want to do an assessment for self-harm. This may look like, helplessness or hopelessness, but just ask the question directly. Are you thinking of hurting yourself or anyone else? Now, as far as management, I can't stress enough that safety is your number one priority. If you're ever considering what your first intervention should be for a patient experiencing a panic attack, the very first question you should ask yourself is the scene safe? Okay. Are they in a safe place? Is anybody else in danger? Are you in danger? Is the patient in danger? So let's say they're in the day room with 20 other people and they start to have this panic attack. The first action should be to remove them from that environment, put them in a calm environment to make sure everyone stays safe. So we want to decrease the stimuli and keep that from getting worse. And then we want to help the patient focus on what's the cause and to kind of make connections between their behaviors and their feelings. So this can help them to potentially address some of the rational thought before they begin to lose rational thought. And then, of course, we can administer medications in the form of anxiolytics, like benzodiazepines is a great example. So the priority nursing concepts for a patient with anxiety are, number one, safety always. We address coping by looking for the root cause, and we monitor mood and affect because we want to look for any signs of possible thoughts of self-harm. Let's recap quickly. A small amount of anxiety can be healthy, can be motivating. Even in response to a stressor, it's healthy. We just don't want anyone to stay there. Make sure you understand the difference between acute, which is sudden and in response to an event, or chronic, which is persistent all the time, even in response to normal activities. Make sure you know what level of anxiety the client is experiencing and what their baseline is. They may have this higher threshold and be at higher risk for the panic level anxiety. And then, of course, safety is first. Always, always, always. Make sure you're watching for those signs of self-harm and ask the client directly if they have any thoughts of harming themselves. Okay, guys, that's it for anxiety.